I am Dr. Rajani Patil. I'm a spine and sports physiotherapist practicing for the last 22 years. I'm the founder of Ortho Sports Physiotherapy. People often get confused when to use a hot pack and when to use an ice pack. And this sometimes can make a critical difference in how the injury improves and how quickly the condition recovers. I find that most people use heat treatment more frequently and rather incorrectly, making their pain worse. As a rule of thumb, I prefer that people use an ice pack for a majority of pain conditions. An ice pack will rarely make the pain worse, and it will most likely speeden up the recovery process much faster than a hot pack will. Cryotherapy or cold compression works by reducing blood flow to the particular area, thereby reducing inflammation and swelling. It also temporarily reduces nerve activity, which in turn relieves pain. Let's look at the scenarios when to use an ice pack. Acute pain. For any pain that has just begun or right after an injury up to 48 hours, an ice pack must be the first choice. This is proven over and over in research. However, after the first 48 hours, a hot pack might be used for further improvement. Muscle spasm and cramps. While most people think that in a muscle spasm a hot pack is more beneficial, that's just not true. A hot pack feels good temporarily, it feels nice and soothes for the time being by loosening up the muscles. But in the long run, it increases the inflammation underneath, gradually tightening up the muscle, and the pain rebounds again. For example, calf cramps or upper trapezius and neck spasms. After sports, an ice bath and ice pack has been known to reduce DOMS, delayed onset muscle soreness, and it also helps reduce the rate of injuries. Hot treatment works by improving circulation and blood flow, increasing muscle flexibility, and by relaxing and soothing muscles. So when to use a hot pack? Subacute or chronic pain. After 48 hours of the onset of pain, it is safe to switch to a hot pack. However, I find that up to 2 weeks cryotherapy still works wonders. For chronic pain, that is pain that lasts beyond 2 months, a hot pack is definitely recommended. That's because now that the initial inflammatory phase is over, secondary changes such as joint and fascia tightness begin to occur, and heat can now speeden up the process by relaxing and elongating those structures. For example, mechanical back pain, muscle and joint stiffness, especially in the lower back or mid back, or if general mobility is an issue, a hot pack does a great job. Poor mobility, which means a lack of range of movement. For example, frozen shoulder. While a hot pack helps to reduce stiffness in the joint, it also helps relax the muscles around the joint, which in turn can help increase the range of movement and hence improve outcomes. Degenerative conditions such as OA knee, osteoarthritis of the knees. Any degenerative condition generally benefits from heat treatment because it helps loosen up the joint and the muscles around the joints and hence giving relief. To summarize, as a rule of thumb, for most conditions, use an ice pack for quick pain relief. Using the ice pack in frequent, short bursts through the day gives maximum benefit. I ask my patients to use the ice pack for 10 minutes, 3 to 5 times a day. I often say, when in doubt, go with the ice rather than hot and you won't regret it.